Now, without further ado, I'll pass it over to Molly to begin.
Wonderful. Thank you. Hello, everyone, and thank you so much for attending today's Health Equity webinar for the Enhancing Oncology model. We will be sharing the link for today's slides in the chat. The slides include additional resources and links related to today's webinar and the model. Next slide, please. During today's event, we will provide an overview of the CMS Health Equity Strategy, the EOM 2023 Health Equity Plan, including an introduction to the EOM Resource Guide and a walkthrough of the EOM Health Equity Plan template. We will then review some resources, information, and additional contacts. And toward the end of the webinar, CMS presenters will answer questions that we've received from the webinar registration, as well as during today's webinar. To ask questions, please use the question function in the Zoom platform. Additionally, for questions specific to your organization, please email the EOM team at eom@cms.hhs.gov. Next slide, please. We will now review some important dates. So upcoming, starting in August, we will have the Care Transformation webinar, as well as the Learning System What's Ahead webinar. Moving into September, we have the PRA Attestation and Health Equity Plan office hours. And then on the 29th, it will be the deadline to implement all PRAs and submit the PRA attestation and optional 2023 Health Equity Plan. I also wanted to flag that the EOM PRA attestation will be available to participants on August 1st. Moving into October, on the 11th, we'll have the EOM Dashboards webinar. And also moving toward the end of the year, I will just flag for you all to look out for dates for the provider and payer affinity groups and the different options that will be offered for you all. And with that, I will go ahead and pass it over to Batsheva. Next slide, please. Thanks.
Great. Thank you, Molly. And good afternoon. I will briefly go over the CMS Innovation Center strategy related to health equity. As a reminder, CMS defines health equity as the attainment of the highest level of health for all people, where everyone has a fair and just opportunity to attain their optimal health regardless of race, ethnicity, disability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, or other factors that affect access to care and health outcomes. CMS is working to advance health equity by designing, implementing, and operationalizing policies and programs that support health for all the people served by our programs, eliminating avoidable differences in health outcomes experienced by people who are disadvantaged or historically underserved, and providing the care and support that beneficiaries need to survive and thrive. CMS understands that true quality does not exist without equity. Advancing health equity is a key pillar of the CMS Innovation Center strategy. CMS's goal is to advance progress in creating a care journey that is free from inequity while optimizing opportunities, access, and outcomes for historically underserved and under-resourced communities. Next slide, please. Now I'll go a little deeper into the EOM Health Equity Strategy. A lot of this might be a recap from previous webinars, but we just wanted to give a quick high-level overview before diving into more details around the Health Equity Plan specifically. Just to recap, EOM seeks to improve quality of care and equitable health outcomes for all EOM beneficiaries. We seek to embed health equity throughout our model design, implementation, and evaluation, including but not limited to how we incentivize care for underserved communities, such as the inclusion of the differential MEOS payment, so the base payment of $70 per beneficiary per month with the additional $30 payment for dual eligible beneficiaries that is outside of total cost of care responsibilities. We have the collection of beneficiary level sociodemographic data. Participants are required to collect and report this information to CMS for purposes of monitoring and evaluation. I did want to flag that the sociodemographic data elements template sample and the clinical data elements template sample are now available on Connect. These sample templates provide participants an opportunity to see a sample of the template that will be used for collection of the SDE and CDE data in the health data repository, so the HDR. This is a sample template only. Templates for submission will be made available in the HDR at the time of reporting and should reflect only attributed beneficiaries. The next item is identifying and addressing HRSNs, or health-related social needs. EOM participants will be required to use health-related social needs screening tools to screen for, at a minimum, 3 HRSN domains, so transportation, food insecurity, and housing instability. One of the EPROs, the electronic patient reported outcomes domains, is also HRSN, so that's how those two are connected together. Next item is improve shared decision-making and care planning. EOM participants will be required to develop a care plan with the patient, including discussion of prognosis and treatment goals, a plan for addressing psychosocial health needs, and estimated out-of-pocket costs. And last but not least, developing a health equity plan as part of the use of data for CQI. EOM participants will be required to do this as part of the Using Data for CQI PRA. And today's webinar will go into more detail around health equity plans. And without further ado, I will pass it back to Nork.
Hi, everyone. My name is Laura Benzel, and I'll be presenting this section of today's webinar, Simplifying the Process of Completing a Health Equity Plan, or HEP. I'm a contractor working on a contract that supports the CMS Office of Minority Health. Next slide, please. So this session follows the EOM resource guide, which is aligns with the EOM HEP template. So this guide offers helpful tactics and resources that you can use to help develop your health equity plan. The sections of the resource guide are organized to match the HEP guide and the HEP template. So I'll be walking through the resource guide in more detail on an upcoming slide so that you can see how it might be helpful. The EOM resource guide, HEP guide, and the HEP template have been shared with you, and we also have links to them on one of the upcoming slides, and I am sure that they're putting the link in the chat as well. Next slide, please. This is a screenshot of one of the pages of the HEP template. So we'll be doing a walkthrough of the template later in the presentation. I'll pull up the actual fillable PDF just so we can walk through it and get you a little familiar with the template. Next slide, please. So this webinar is being brought to you by the CMS Office of Minority Health. CMS OMH is collaborating with the Innovation Center on the EOM Health Equity Plans with consultation, technical support, and resources. The mission of CMS OMH is to lead the advancement and integration of health equity in the development, evaluation, and implementation of CMS's policies, programs, and partnerships. Their vision is that all those served by CMS have achieved their highest level of health and well-being, and we have eliminated disparities in healthcare quality and access. Next slide, please. So let's begin our discussion of the EOM HEP, or Health Equity Plan. So as you begin developing your HEP, it'll be helpful to have these documents available. The first document is the EOM HEP Guide, which provides details on the requirements for the HEP and how to complete it. The 2023 HEP Guide can be found on the EOM website and Connect. The preliminary 2023 HEP template is a fillable PDF that you'll use to provide details of your HEP. So the HEP template can be found in Appendix A of the HEP Guide, and it's also in the participant portal. You have the option to submit a preliminary HEP by September 29th, 2023. This would be in performance period 1. The first annual HEP is due by March 29th, 2024, and that will be in performance period 2. Another document that you may also find helpful is the CMS OMH Disparities Impact Statement. This tool will help you to identify, prioritize, and take action on health disparities. It's also a fillable PDF worksheet with 5 steps, and it includes an action plan to help in the development of your HEP. So the resource guide outlines tactics that are based on the disparities impact statement and was designed to complement it. So you can find screenshots and a link to the disparities impact statement in the appendix of this presentation. Next slide, please. In the HEP guide on page 7, you'll find instructions on submitting the HEP fillable PDF template via the EOM participant portal. The 2023 HEP template is currently available in the portal and the submission window is now open. So again, while the 2023 preliminary HEP is optional, the benefits of submitting the HEP include review and feedback from CMS, as well as additional time to review and develop your health equity plan before the required submission and performance period 2. We encourage participants to consider submitting the optional HEP as a tool to developing your health equity strategies. Specifically, identifying and monitoring where disparities exist in your EOM beneficiary population, and also using data to implement evidence-based strategies aimed at addressing the identified health disparities, as well as advancing health equity. For participants planning to submit the optional 2023 preliminary HEP, please review the instructions, complete each section within the HEP template, and submit responses in the EOM participant portal by September 29th, 2023. If you have any questions, please reach out to the EOM help desk. Their information is there on the slide. And we'll also have office hours focused on the PRA attestation and HEP on September the 13th. Next slide, please. So now we'll review the HEP template questions. And as I mentioned, this will be followed by a walkthrough of the actual template. Next slide, please. So the preliminary HEP template consists of 12 questions across 4 categories. And those 4 categories are using data to identify and select underserved communities, health disparities, and evidence-based interventions, setting goals and monitoring progress, identifying beneficiary and caregiver needs and organizational implementation strategies, and community partner engagement. So we'll walk through the HEP questions and discuss helpful tips and tactics for responding to the questions to complete your HEP. Next slide, please. So let me quickly walk through the resource guide and how it's organized. This is a partial screenshot of the resource guide of 1 page. And so let's walk through it starting at the top. So at the top, you'll see category in yellow. The category is one of the 4 categories on the HEP template that I just shared on the previous slide. Then you'll notice that the HEP guide section 6.1 and template questions 1.4 are highlighted in blue. So this is letting you know that this section of the resource guide aligns with that section of the HEP guide and those template questions. Under that, in dark blue, you may notice identify data sources. This is one of the subsections that is specific to the resource guide. So it's just letting you know that the tactics in this section are about identifying data sources. So you'll see several different subsections that will help you navigate the resource guide. And below that are the actual tactics or tips for identifying data sources. And we've included helpful resources with links in the column on the right. So once you start working with these documents, the information will make sense and be helpful to you as you develop your HEP. Next slide, please. Section 1 of the HEP template is identifying and selecting underserved communities, health disparities, and evidence-based interventions. You'll find more detailed information in section 6.1 of the HEP guide. This section is covered in the template questions 1 through 4. Next slide, please. So these are the 4 template questions. I'm not going to read each one. They're here as a quick guide. But in summary, this section of the template pertains to defining data sources and how you'll use the data to identify underserved communities, health-related social needs and/or health disparities, and develop evidence-based interventions. Next slide, please. So when you refer to the resource guide, you'll see these tactics in that first section. So these are tips that we're offering to help you complete your HEP. So the first one is for defining data sources. The first tactic is to research publicly available as well as internal data sources that can help you identify and prioritize the underserved community and health disparity that your organization will address. Also, you want to use both quantitative data, such as health outcomes data, as well as qualitative data, such as patient surveys, for the best assessment of health disparities and their impact on the underserved community. You'll find that external data sources are usually most beneficial in the initial stages of researching disparities in underserved communities. But as you hone in on a potential disparity or health-related social need to address, internal data will be the best source for a granular evaluation of gaps in care specific to your EOM underserved communities. Next slide, please. So this slide lists some examples of publicly available and internal data sources. This is, of course, by no means an exhaustive list. In the resource guide, we have links to a resource from the CMS Office of Minority Health that offers a more comprehensive list of publicly available data sources. And of course, the internal data sources will be specific to your organization, but these are just some examples that we found other organizations have used to develop their health equity plan. Next slide, please. So I'd like to take a moment to talk about the importance of patient data collection. Identifying and addressing health disparities requires a commitment to collecting meaningful patient sociodemographic data. These data will provide valuable insights into the populations you are serving and how best to meet their clinical needs and their non-clinical needs. And so what we mean by non-clinical needs, of course, are health-related social needs, such as food insecurity, unemployment, or housing instability. So as a part of EOM participants are required to collect sociodemographic data from EOM beneficiaries. A key goal of data collection is to help improve the quality of care. So the best practice is to have a standardized process for collecting the data that you see on the slide. We've included this information also in the resource guide so you can determine what best practices around data collection that your organization already has adopted, but also where there may be opportunities for improvement. A standardized process for collecting, validating, stratifying, and analyzing patient sociodemographic data helps to improve the quality of care because you can then identify, of course, and address health disparities, measure and evaluate the impact of any health equity interventions that you implement. The data can help you assess whether care is culturally and linguistically appropriate. Also, you can gain insights on patients' lived experiences based on multiple dimensions, which depends on the data that you're collecting. So what I mean as an example is an individual living in a rural area whose primary language is Spanish, so they have limited English proficiency and they're experiencing unemployment. So considering all these factors when providing care will be key to ensuring that this patient reaches optimal health. So the EOM resource guide provides a few best practices around patient data collection. So for example, a best practice is to allow patients to self-report their data, collect race, ethnicity, and language data at a minimum for at least 95% of your patients. You want to embed opportunities for data verification at multiple points of care, and this will help you to ensure the accuracy and completeness of patient data. Also, a best practice is to use Z codes to document identified social determinants of health in each patient's medical record. Next slide, please. So let's shift back to the resource guide. And the next subsection is describe health disparities in underserved communities. So when you identify a disparity, it's helpful to determine the contributing factors and what actions your organization can take to address them. So this is a key step because it'll help you to find the intervention to address the disparity, and if it will be feasible for your organization to implement it based on your resources and staffing. We strongly suggest selecting 1 or 2 disparities to address for your HEP. Choose one disparity that, when addressed well, will have the maximum impact. Clearly and concisely describe the disparity in your HEP template. And even if your organization is currently implementing multiple interventions to address disparities, it's important to list only those disparities you'll address and monitor for your HEP. It's not necessary to list all of your organization's health equity interventions. Also, in the HEP template, you will clearly explain the rationale for the selected health disparity or the health-related social need and the prioritized underserved community. And you also want to clearly describe the underserved community that will benefit from the intervention that your organization plans to implement. So as we go through the template, you'll see where you can enter this information. Next slide, please. So once you've selected a health disparity and underserved community, you'll need to identify interventions to address the disparity. So before we dive in further on this, we do want to emphasize a key disclaimer found in the 2023 EOM preliminary HEP. As a reminder, for purposes of the HEP, the EOM participants' health equity interventions should be designed and implemented without regard to an EOM beneficiary's race, ethnicity, national origin, religion, sex, or gender. EOM participants can design and implement their health equity interventions using other factors, including but not limited to an EOM beneficiary's medical history, their health status, their health needs, their income, and their geographic location, so long as the EOM participants and all other individuals and entities involved in the HEP activities comply with all applicable anti-discrimination laws and regulations. So in your HEP, plan to describe the intervention that your organization will implement to address the identified health disparity and how the intervention will advance health equity for your underserved community. When possible, use evidence-based interventions because they are empirically supported treatments that are proven effective through outcome evaluations. And once you implement your intervention, it's recommended that you use an iterative process such as the Plan, Do, Study, Act, or PDSA model to refine the intervention until it's running effectively, and really importantly, that the data confirms that there's an improvement. So we've included a link in the resource guide to more information on the PDSA model, and also I'll be talking about it more in an upcoming slide. So be sure to think about and identify challenges and barriers that you may face in implementing your intervention, and also how you plan to mitigate them. Next slide, please. So this slide gives 4 examples of evidence-based interventions. There are additional examples in the HEP guide, and in the resource guide, you'll find sources of evidence-based interventions that you may find helpful. So we encourage you to tailor your interventions based on your patient's needs, and then update the interventions over time based on feedback from them. So get that feedback, and you may need to adjust your interventions to meet their needs. Next slide, please. So the next template questions are 5 and 6, and they pertain to setting health equity goals and monitoring progress. You can find more information in section 6.2 of the EOM HEP guide. Next slide, please. These are template questions 5 and 6. And again, I won't read those, but these questions are all about setting goals and defining performance measures for the current year and also for subsequent plan years. As you can see, there are sub-questions for each of these. And again, when we get into the template, we'll review these in a little more detail. Next slide, please. So let's talk about establishing goals. In this section of the resource guide, which is about monitoring and evaluating progress, you'll see 2 tactics for establishing goals. You want to set immediate or short-term goals and also create a plan for making long-term progress towards achieving those identified goals. And we recommend that you do this throughout the course of the model. You want to revisit those goals on a regular basis and readjust your action plan if needed. And also we recommend that you make the goals SMART. That's an acronym that you're probably familiar with, but let's go to the next slide and talk about that a little more. So your goals are going to drive your action plan for addressing the identified disparity and or health-related social need. So when thinking about developing your goals, you want to consider the following guidelines for making them SMART. First, you want to make your goals specific. You also want to make your goals measurable, thinking about how you will measure and evaluate if the goal is being reached. Make your goals attainable. You want to take into consideration what is feasible for your organization. Make the goals relevant, describing how the goals will address the disparity that you identified. And really key, be sure that your goals are time-bound, setting a target date for achieving them. Next slide, please. This is an important section because identifying metrics is key to monitoring the progress of the intervention that you implement to address the identified disparity. We recommend that you develop a plan for how you'll monitor and track your progress. So I'll explain this in a bit more detail on the next slide, but let's just talk about these tactics. The recommendation is to identify 1 or more quantitative performance measures to track and measure progress toward meeting defined outcome measures. And a really important point is you want to set a baseline before you take action. You'll need to set a baseline to assess performance throughout the duration of the model performance period. So pick a point in time, collect baseline data, and set your baseline before you start implementing any interventions. Also, you want to include the data sources for the selected performance measures. Where are you going to get the data? And also key is monitor your outcomes frequently because you want to assess progress so you can revise your goals and also establish a process for continuous quality improvement. So be prepared to revise your goals and action plan if the intervention is not achieving your targeted outcomes. Obviously, you don't want to get to the end of the year and realize that you aren't going to meet your goals. So monitor frequently And we recommend using the PDSA methodology to adjust the intervention, test the changes until the intervention is meeting those targeted outcomes. And lastly, describe the processes to be used for collecting the data, analyzing the results, and evaluating progress on implemented interventions. Next slide, please. So when thinking about which quantitative measures are useful for evaluating and monitoring your intervention, consider asking these questions to help you decide and also to develop a plan to guide the best way to track, display, and also to assess the data you collect from the intervention, and ultimately if the intervention is succeeding. So questions to consider: how are we measuring? How often are we measuring it? How do we measure it? Where do we get the data? Who is responsible for tracking? What is the performance goal or aim? How will findings be tracked and displayed? And also, what key milestones can you identify in your HEP for evaluating performance? Next slide, please. So you may remember that I referenced the Plan, Do, Study, Act, or PDSA model. So you may be familiar with it, but just as a reminder, PDSA is shorthand for testing a change. It's a simple but really powerful tool for driving progress, and it can be used to test really any change you identify in your work setting to determine if the change will be an improvement. So after you test the change on a small scale, you apply what you learned, and then you refine and test the change through several PDSA cycles. And once the change is working, you can then implement it on a larger scale. So the PDSA model begins with 3 questions to help inform the cycles. What are we trying to accomplish? How will we know that a change is an improvement? And what change can we make that will result in an improvement? So there's a link to more information on the PDSA methodology on the slide. You can also find it within the resource guide. Next slide, please. So template questions 7 through 11 pertain to identifying beneficiary and caregiver needs and organizational implementation strategies. You can find more information about this in the HEP Guide section 6.3. Next slide, please. These are template questions 7 through 11. We'll talk more about these again when we review the HEP template. Next slide, please. So the patient is the center of care of the care team. So it's important to create a plan for engaging beneficiaries, their caregivers, their providers, and staff in shared decision-making. You want to commit to providing culturally responsive and linguistically appropriate care according to the HHS National Standards for Culturally and Linguistically Appropriate Services, or CLAS, for health and healthcare. You might want to consider creating a patient advisory council to get qualitative input to better understand the drivers of disparities, to get input to validate your organization's actions and plans around disparities, and to really ensure that the perspective of the underserved community that's experiencing the health disparity and who will also be affected by your intervention are reflected in your quality improvement efforts. Also key is to designate a leader, someone who's passionate about health equity, who will engage clinical champions, patients, families, and working partners and community collaborators to contribute to your action plan to reduce disparities. Next slide, please. So for organizations committed to a culture of equity, culturally and linguistically appropriate services are important for promoting health equity. CLAS improves the quality of service that you provide to all your patients by being responsive to diverse health beliefs and practices, language preferences, communication needs, and health literacy levels. And CLAS can also help make your services more respectful, understandable, effective, and equitable. You can get more information on the HHS Think Cultural Health website. They have information on the CLAS standards, including resources for assessing your organization's progress in addressing and implementing CLAS. And so there's a link here on the slide, and we also have the link in the resource guide. Next slide, please. So HEP template question 12 is about community partner engagement, and you can find more information in section 6.4 of the HEP guide. Next slide, please. So this is the last question on the HEP template. So when thinking about addressing disparities and especially health-related social needs, engaging and collaborating with community partners really will be key to successfully addressing those disparities. Working with community resources provides a unique and powerful partnership to build collaborative relationships and also to build trust. So every EOM participant's community obviously is different based on demographic and geographic location. So ideas for community resources include state and county public health institutions, area agencies on aging, social service organizations, places of worship, and other agencies and organizations that serve these communities. Next slide, please. So the final section of the resource guide is community engagement, and there are 4 tactics to successfully implement your HEP. Those community partners will again be essential. So we recommend creating a community engagement plan, and I'll talk a little bit about that more on the next slide. You want to create or enable access to community referral inventory. So an inventory of those resources where you can make referrals to address health-related social needs and other disparities, and also designate a person to review and update these resources on a regular basis. You want to facilitate screening, referrals, and navigation services for health-related social needs. So a patient may screen positive for health-related social need and you make a referral. So you want to monitor the referral to community partners to determine if the referral was successful in meeting the patient's need. And we also recommend following up directly with the patient to see if they felt the need was successfully met as well. And again, as we discussed under beneficiary engagement, you want to designate that leader who's passionate about health equity and is willing to engage with clinical champions, patients, families, and also your working partners. Next slide, please. So we talked about developing a community engagement plan. So, you want to have a plan on how you're going to engage and collaborate with partners, both internal and external, who will serve the underserved community that you have identified. You want to talk with your partners about the local resources, services, and skills that you can leverage to address the identified disparity and health-related social need. You may want to consider creating what's called an asset map so that you have a sense of what local resources you can bring to your work. This step will also help you to identify new partners with strengths that you can draw on. So this slide includes some questions to consider as you develop your community engagement plan. Next slide, please. So this is a suggested resource. They call it a stakeholder asset map. You can use it also to develop your community engagement plan. It's listed in the resource guide, and we also have the link here in the slide. Next slide, please. So I am going to bring up the templates. Can I please get confirmation that we can see the template? Great. So let me quickly walk through the template. This is the 2023 Preliminary Health Equity Plan template. This first page is important information that you want to read because there are important dates in here, some of which we covered today, but also other important dates that you want to keep in mind, and just information around health equity. But this second page is the first page where you are able to add information. So any place you see this lavender blue color is where you're able to enter information. And as you can see here at the very top is information about you and your organization, who is responsible for the health equity plan, and contact information. Additionally, CMS would like your organization to read this statement and check the box to attest to the information in that statement. And then you can see here, as I discussed throughout the presentation today, the template aligns with the resource guide and also the EOM guide. So you'll see here, this is the first section where you're going to list the data sources that your organization will use to identify disparities. You can see we have two columns, external and internal data sources, and we have some drop downs to help make that selection easy. So examples of external data sources, and here we have internal data sources. If you pull down the drop-down list and there's nothing in that list that pertains, you can add additional information here down in the other box. As you select a data resource, we would like to have the data, the year of the date or the date of the data source. What did you learn from the data, and also a link to the data source. In this next section of the template, you'll see question number 2 is where you'll define your organization's process for collecting patient sociodemographic data. If you already have a process, describe that. If you're developing one, you want to put that in this section. And then we go into the section where you'll identify the health-related social need and or disparity and your prioritized underserved community. Again, we've provided some drop downs to help you fill this section. Please note, you don't have to complete all of these. It really depends on what your data and the community that you've identified to prioritize. So for example, if you're going to be addressing a health-related social need, we have some listed here. But again, if none of those fit your need, you can put other, or actually, if you select other, we would prefer you select other and then describe what that other social need would be. And that is the same for each of these areas. So you may be deciding that you're going to address a risk factor, and you can see here we have several listed. Or you may be addressing a disparity around a particular condition. And again, you can select from the drop down. And over here in this section, we want you to please identify the data source that you use to identify the condition or disparity that you plan to address, and a little more information on why you selected that underserved community and also why you selected this intervention. So you'll put that information down here in this section. If there is another intervention that you would like to implement, this is just identical to the previous section where you can talk about that secondary intervention. And then down here, number 4 is what evidence-based intervention will you use to address the disparity? Again, we've provided some drop downs for you. If none fit, please select other and then describe the other intervention. and then provide some more details of the actual evidence-based intervention that you will be implementing. Just a note, these sections are unlimited, so you can just type and it'll just continue to expand. Question 5 and 6, again, are about goals and monitoring progress. So here is where you enter your goals. Here is where you'll define the action steps that you'll take to achieve those goals, how you're going to monitor progress, what measures you're going to use to monitor progress. And all of that information will go here in questions 5 and 6. 7 through 11, these questions are about the staff that will be responsible for implementing and monitoring your HEP, how you'll engage beneficiaries and caregivers, identify and describe any potential challenges that you anticipate, and importantly, how you plan to mitigate those challenges. And then also what safeguards that you will implement to ensure that all beneficiaries, of course, including your prioritized underserved community, are going to receive equitable care. And then the last question is how you plan to engage your community partners to help you address your health disparity. So I realized that was a quick scroll through, but we wanted to leave time for questions. So I am going to hand it back over to Deloitte. Thank you.
Wonderful, thank you. And I believe I'm passing it to CMS to answer some questions.
Yep. Thank you so much, Molly. And thank you, Laura, and also Botchful for that wonderful walkthrough of our health equity strategy for EOM. I think especially the tactic strategy and also a walkthrough of the actual template. Hopefully you all found that especially helpful. Let's go ahead and let's go ahead and get started on a couple of the questions here. And this first one, Botchka, I'm going to direct this to you. So as Laura mentioned earlier in the presentation for EOM, the health equity plan is optional in the first performance period, but then it is required starting in performance period 2. Can you talk a little bit about why it might be beneficial in submitting the health equity plan for EOM earlier in 2023, even though it is optional?
Yeah, of course. And thank you for that question. While the 2023 preliminary HEP is optional, as you mentioned, some of the benefits of submitting the HEP include the CMS review and feedback, as well as additional time for participants to review and develop their health equity plans before the required health equity plan submission in PP2. We do encourage participants to consider submitting the optional HEP as a tool, and the HEP really is intended to be a tool to facilitate the development of interventions based on evidence-based strategies. And so having a tool in place to identify and monitor where these disparities exist is really the goal of the HEP. And so having that and setting up that basis sooner from the model start and just allowing that time to build in the HEP as well as get feedback, we wanted to offer that as an option to participants.
Great, thank you so much for that insight. I'll take this other one actually, which Laura had walked through what this actual HEP looks like. Hopefully, you all have had an opportunity to go through it with her as well. But just for logistics, if you're wondering how your practice may submit that 2023 preliminary health equity plan, if you look on page 7 in the HEP guide or the health equity plan guide, there's instructions in there on submitting that fillable PDF template via your EOM participant portal. So you'll first log on to the EOM participant portal and then navigate to the agreements and attestation section, then the health equity plan tab. So if you click around in there, I'm sure you'll find it. Then from there, you'll find the fillable PDF of the HEP template to complete and submit. You can go ahead and download that PDF directly and then resubmit it once you have completed all of the content. and then have the subject line be your EOM PGP, and then whatever your participant ID is, and then HEP. The 2023 HEP template is currently available in the portal now. So please, we do encourage you to go in there and take a look at it, look at the questions and the different sections. And also the submission window is now open. For the participants, for you all who are planning to submit the optional 2023 HEP, please review the instructions. Again, please complete each section for the template and submit responses to the participant portal by 5 p.m. on September 29th, 2023. Of course, if you have any questions at all, feel free to reach out to us at the help desk, so at eom@cms.hhs.gov. And also, as a reminder, we're going to have an office hours focus on the PRA attestation and HEP on September 30th. Also want to provide a reminder as well that as we described in section 5 of the HEP guide, CMS plans to review all HEP submissions within 60 days of the final submission, and we will notify you all of any issues or questions about the HEP at that time, as well as any revisions that we may request to conform to the instructions. If you are being asked to revise your HEP, then we ask that you do so within 30 days of receiving CMS feedback. Okay, looks like we have another question here, and Bachma, I'm going to direct this one to you. Someone had asked, can we focus on disparities related to behavioral health or mental health conditions?
Yeah, thank you for the question. And as Laura mentioned earlier, EOM participants can design and implement their health equity interventions using factors including but not limited to a beneficiary's medical history, health status, health needs, income, and geographic location. I think when we went through the template together, there were some examples of drop downs, whether that was health-related social needs, other risk factors, or conditions. So if those are areas that are important to your beneficiary population and there's evidence-based to support the need for an intervention to improve a health disparity, then that most certainly can be one of the interventions identified. And if it's not listed currently in the categories, please do select the other option and include details for those conditions. Thank you.
Right. Bachma, another question here, maybe you can help us explain more, is the disparities impact statement essentially the same thing as our health equity plan for EOM? Is it possible for EOM participants just to complete the disparities impact statement and submit that? And would that meet the requirements of our EOM HEP?
Yeah, that's a great question. So the disparities impact statement is really meant to be used as a guide or a resource to help complete the EOM HEP. However, participants must submit the EOM HEP template, so the one that Laura shared today, to be able to meet the participation agreement requirements. So the HEP template provided to EOM participants, and that's on the participant portal, is more detailed and tailored to the model specifically. But we do encourage participants to use the DIS as a resource if it is helpful, and we're happy. And when we've provided an example of DIS for EOM participants as well, if there are any questions there.
Great, thank you. And Bachma, I think this might be the last question. So we, have been using the term underserved communities quite often, and you see that a lot as part of a lot of health equity strategies as well. Can you explain a little more in terms of who is defined as underserved communities?
Yeah, thank you for that question. So the term underserved communities refers to populations with shared characteristics in geographic communities that have been systematically denied full opportunity to participate in aspects of economic, social, and civic life, such as Black, Latino, and Indigenous and Native American persons, Asian Americans and Pacific Islanders, and other persons of color, members of religious minorities, lesbian, gay, bisexual, transgender, and queer, LGBTQI persons, persons with disabilities, persons who live in rural areas, and persons otherwise adversely affected by persistent poverty or inequality. In referencing members of rural communities, we are inclusive of individuals in frontier areas, tribal lands, and those residing in the U.S. territories. And this definition aligns with broader CMS and HHS definitions for underserved communities. I will note, though, that we did have that disclaimer earlier that we want to emphasize that interventions should be made available to all beneficiaries and all patients, and should not be specifically targeted to any particular group in regard to beneficiaries' race, ethnicity, national origin, religion, sex, or gender. That's to be said that designing and implementing an intervention using other categories, as I mentioned, such as the medical history, health status, health needs, income, and geographic locations are a good start there. We just want to make sure participants are compliant with any anti-discrimination laws and regulations when they're designing their interventions. So mindful of your communities, but also designing your interventions so that they are not limited to any particular group. Although one group or although group may benefit more than another, that is fine. We just want to make sure that participants are aware of that.
Thank you so much, Batsheva, for that clarification. I think that concludes the Q&A portion of this webinar. I do want to remind folks that if you have any additional questions that you think of or didn't have an opportunity to ask here today, please feel free to reach out to us at our help desk. Or as another reminder, we will be having an office hours on September 13th to go through the health equity plans and any of your questions at all regarding EOM's health equity strategy. And with that, I'm going to quickly turn things over to Molly to help close us out.
Thanks, Alex. So just before we close out, I'd like to remind you all of several resources available to you, including today's presentation slides shared in the chat. You can find all of today's resources as well as resources from past events in the Connect library. To access these files, log into your Connect account and hit Files in the upper right-hand corner of your screen. You will then see the folders listed on the screen, and all materials will be organized by topic. We can go ahead and skip to the contacts page. These next couple of slides are resources from today. Wonderful. This slide here is just a reminder if you all need our contact information. You've got the EOM website as well as the help desk, the Connect website, and our Twitter handle. Next slide, please. Wonderful. Well, I wanted to thank all of our speakers for today. Before we wrap up, I'd also like to note that when today's webinar ends, you will be prompted to complete a brief survey. We sincerely appreciate your feedback as we seek to improve future events. That concludes our event. Thank you to everyone for joining, and again, for all you're doing to enhance oncology care. Have a wonderful rest of your day.